Number one question everybody asks me, how did you know? Well, I was driving home and all at once I turned to look in a lane to see if there were any cars, and my head stuck and I couldn't move it back. My girlfriend, who's a nurse, I had told her about it, and she made me promise that if I had anything else like that, I would go see a doctor. And so I went to my primary physician and she said, I have to tell you something. She said, you have a mass on the right frontal lobe. And I said, what do I do now? And she said, well, you need to get to a neurosurgeon right away. Well, I didn't know one. And so she said, I'll give you a name of one. And that's when she gave me Dr. Michael. Thank God. I went to Dr. Michael and he said, we got to get this out right away, right away. And he said, I'm sure this is glioblastoma and it's not good. We asked him to be upfront and honest with us, and he was, but we weren't prepared.
First of all, it's never good to have a brain tumor, but some brain tumors carry a better outlook than others. Unfortunately, glioblastoma multiforme carries the worst outlook of any tumor a person can develop.
I knew up front what we were dealing with. Dr. Michael seemed to be knowing what he was doing, and he was giving me good information, and I just had to trust God, that's all.
The technology in removing these things has evolved, and we at MHSI have access to the latest technology. We used something called image-guided surgery to try to remove as much tumor as we can safely without disturbing any of the important brain structures near the tumor.
The day he came in and told me that the tumor was gone, he hopped up and hugged everybody in the room.
This is where the tumor was, and this is with contrast, so if there was any tumor, it would light up bright white, and there's no evidence of recurrent tumor in that area.
It has been 2 years. After a year, Dr. Michael walked into the office and he said, you've beat the odds. That was after a year.
And she really surprised everyone. She not only exceeded the 14-month average, but she survived nearly 2.5 years following her initial diagnosis of glioblastoma multiforme.
Just know you got to be positive to fight this, that's all. People need to stay positive and they have to look for the silver lining in things.